All the back pain and the spine problems which commonly faced by normal people, they are mostly the mechanical back pain. And it depends how you have suffered with those back pains. Depends the whole treatment protocols are done. It might be due to poor posture. It might be due to any of your household things and any of your long sittings on a computer hours. So the advanced rehabilitations, what we do in our setups at Fortis, what we do is basically we add on a lot of features, additive features in the advanced rehabilitations, which are not commonly being used in normal people. Usually the people have few sets of exercises they do, and sometimes it works, sometimes it doesn't work. Mostly it doesn't work if you have not diagnosed it correctly. With your neuromuscular rehabilitation program, we have a special back program where we do the strengthening of the spine muscles in different way. First, we diagnose it very properly, and very specifically we see what mechanics lead to that particular kind of back pain. There are 3 layers of back muscles, and we need to strengthen the core muscles of the back, and that's very important. And if we are not targeting the core muscles, the effect doesn't last for a long time. So there are 3 phases of rehabilitation. Very first, we do the pain management. So whatever pain and muscular spasm there, we reduce with the advanced form of cold lasers, myopulse, and kind of a lot of manual therapy techniques. The second phase comes of realigning and giving ergonomic sense to the patient that how they have to be straight and how they can sit more straighter form. This is done by dynamic neuromuscular rehabilitation forms of exercises where they learn the dynamic exercises. There are 2 forms of exercises. One is static, which you keep on lying on a bed and do. There's another form which is called dynamic, where we move the whole spine in a controlled way so that the strengthening happens to the spine. And the third phase is to gain the flexibility of the spine so that the reoccurrence is very less. In advanced rehab, again, we have to increase the strength. We use spine force, and we do have some decompression equipments where we do the disc. The problem is from the disc. And regarding the spine force, it's a very unique form of rehabilitating the spine. We make the patient stand over the platform, and there's a special sensors in your hands where you move the whole spine, and your whole trunk develops a control while you're getting up and down, and whenever you go down, you try to pick up something. There's not going to be getting a catch if you particularly strengthen your muscles in a dynamic way. In advanced neuro rehabilitation program, and we say it's basically a back strengthening program. We call this program very specific program. Is called back enhancement training. What we do in the back enhancement training, we have 3 phases where we do that. Very first phase is we do a very deep assessment. Second phase, we try to get patient out of the pain, and the third comes in the strengthening phase. So a lot of phases, if you take rest, it goes off. But the most important form is the strengthening program. We have spine force, where we take dynamics stabilization of the back. Second, we have advanced neurodynamic rehabilitations for the back. So we train the muscles in dynamic form. And the third form is we do core muscle strengthening, which the patient take it as a home exercise program. Once we do all these 3 things, it becomes a very cumulative approach that give a back a very rigid and firm sense, and the patient doesn't have recurrent back problem again and again.